Senate Majority Leader Mitch McConnell saying just moments ago that GOP Republicans are, quote, getting closer to having a health care proposal. McConnell declined to give an exact timeline for the health care plan going to the Senate floor for a vote. All of this coming as Republican congressional leaders are gearing up to meet with President Trump any moment now at the White House to discuss the status of health care reform, tax cuts. But while Senate Republicans struggle right now to come to a consensus, the nightmare of Obamacare continues to get worse. We've received breaking news that yet another major insurer, Anthem, will exit the Obamacare insurance marketplace in Ohio next year. We are joined now live from the White House by the press secretary to Vice President Mike Pence. Marc Lotter, good to see you. Thank you for joining us, Mark.
Thank you for having me on this afternoon.
You just attended the Senate GOP meeting with the Vice President. What can you tell us about the GOP's plans to reform the health care bill right now that the House put forth? What is the Senate looking at?
Well, the one thing that you know right now is that Republicans are united behind Donald Trump and the president's vision to make sure that we can lower health care costs and improve access to Americans across the board. We've seen another example just today about how Obamacare is collapsing under its own weight, with Anthem pulling out of Ohio, which is going to leave up to 20 counties, struggling to find health care coverage. So the president and Republicans are united across the board that we've got to do something.
Right.
This is not just repair and replace. This is now a rescue mission on behalf of the American people.
It is a rescue mission, and we've had 7 years to consider some of the options. What are the options being presented right now?
Well, I think right now what you're looking at is obviously the House has passed its version of the legislation. The Senate is now taking that up. And what we just saw where the Vice President was meeting with the 52 members of the Republican Senate is they're coalescing around a series of ideas that uphold the President's principles that we've got to lower costs for Americans, and we also have to improve access to health care. So they're working through the fine details right now. As the Senate leader just said here recently, that when that bill is ready to come to the floor, they'll call it down for a vote. But we're making good progress on that. That's what you saw the Vice President on Capitol Hill doing today.
How different will the Senate version look than the House version of repeal and replace?
Well, there are a number of ways that you can approach this. The bottom line is not necessarily the process of how we get there. It's what we get, the end result that we get to. And that's what is really the focus right now here at the White House and on Capitol Hill, is making sure that we're lowering premiums. You've seen premiums more than double across the board since Obamacare has come into place. So Republicans are working through the various ideas of providing more state flexibility, allowing states to do the things that they do very well, which is to innovate, to deliver better care at lower cost for all Americans, and then also allowing businesses to get together to provide better health care across the board for their members and people in their business associations. So those are the kinds of things that you're going to see pushed. We're going to get there, and it's good to see the movement in the Senate. You saw Senator Bill Cassidy come out today, say that he's getting on board with the way things are headed. That's the kind of movement that we want to continue to see in the coming weeks. So
let's talk about the timeline here. Is getting a bill passed by the end of this month, is that possible?
Well, I don't want to get into timelines, Lauren, right? That's one way when we set up artificial timelines that things start to break down. But I think the one thing that we can focus on is that Republicans in the Senate, here at the White House, under President Trump's leadership, are working toward a goal of getting this system repaired, replaced as quickly as we possibly can. That's the goal for everyone involved.
And how does this play out in the 2018 midterm elections, when senators have to go back to their constituents and say, okay, these are the changes, this is what happened to your health care? How does this play out? Does this change the Republicans' message at all if nothing gets done?
Well, Lauren, this is really not about looking ahead to 2018 or any other year. This is looking ahead to next January, when companies like Anthem are pulling out in Ohio. You see other insurers in Missouri, insurers in Iowa that are pulling out of the exchanges, leaving people vulnerable. Those are the people that President Trump, Vice President Pence are focused on. And when Republican members are able to come together around a plan, what you're going to see is that people are going to see that their health care can get back to the way it used to be, where they had control over it, where you didn't see premiums increasing over 105%, which is $3,000 for the average family. Yeah. Those are the kinds of things that the president, the vice president, and Republican leaders on both sides of the Hill are focused on.
Speaking about real money for the average family, a lot of consumers, a lot of businesses are hoping for tax reform. Any idea on when we will see it? Will we see it by the end of the summer?
Well, again, we're getting into timelines. I think last night the White House's legislative director said probably going to start to see movement in terms of an actual bill maybe after Labor Day. But this is another area where you're seeing Republicans working behind the scenes, coming together around a plan that's going to deliver real tax relief to Americans and really get this economy kick-started. We can no longer, as President Trump said, just accept 1.9% growth on an annual basis when just historic average growth has been 3% in this nation. Those are the kinds of things, when we get this economy moving forward, again, Americans will have more money in their pocketbooks. They'll have jobs that provide health insurance, so they're not having to get onto the Obamacare exchanges or maybe dealing with individual policies on their own. These are the kinds of things, when we can unleash the American economy that President Trump knows that we can, we'll get our economy moving. There'll be more tax revenue flowing in, and the more people will have jobs and security at home.
Focusing on the domestic agenda, Marc Lotter, thank you for your time today.
Thank you.